While hospitals deal with the influx of coronavirus cases, there's growing concern that non-COVID medical emergencies are taking a back seat. CBS NLA's Leslie Marin spoke to the president of the Los Angeles Board of the American Heart Association, Dr. John Harolds.
When should someone be calling 911 during this pandemic?
Well, traditionally, people who have symptoms of a heart attack or stroke would call 911 and would be transported to the closest stroke center or heart center for management and diagnosis. What we've seen over the past several weeks is a decrease in the number of people seeking help, and we are concerned that many of these people are dying at home because of the fear of calling 911.
That is a pretty scary thing that you guys have now seen. We are obviously talking about heart attacks and strokes, which are a very common 911 call. So what are the symptoms of a stroke or a heart attack that people should be aware of?
Well, the Heart Association and other professional societies have really focused on this for years. A heart attack, of course, would be chest pain, difficulty breathing, any discomfort in the chest, arms, back, neck, shoulder, or jaw. Or for strokes, any new numbness, weakness, loss of movement in the face, leg, or arm, any confusion, trouble speaking or understanding, loss of balance. And, the Heart Association has been focused on patient education that when you have these symptoms, think you're having a heart attack or stroke, you have to call 911 because the ability to treat these conditions is predicated on the time of onset of symptoms. And many people with heart attacks will die before they get to the hospital if they don't call in time. And this phenomena has been well documented and has been seen across the country. But during the COVID-19 epidemic, we've seen almost a 40% drop in the diagnosis, at least the presentation to hospital systems of heart attack, a little less for stroke. And we're concerned that reflects patient fears of call 911, but it may be other issues, but I can talk about that as we go on.
Yeah, definitely. What are some of maybe the other issues that a person may have because they're not calling 911?
Well, again, the focus since the pandemic has begun is on social isolation, and people are fearful of going to any hospital facility or any emergency room, and very often, they may have symptoms that would, in other times, have led to an immediate call of 911 where they delay the call. This information has played out in a dramatic way in New York. We have there's a website, angioplasty.org, which on April 8th quoted an interview with the New York paramedics, and there was almost 2,000 cardiac arrest deaths between the period of March 30th and April 6, 2020, and of those, almost 1,500 could not be revived. That was an 8-fold increase over 2019. And we don't know for certain if those patients had called sooner, whether or not they would have been able to have been, treated appropriately, resuscitated, and brought to the hospital. But the key issue is heart attacks and stroke continue despite COVID-19, and we have to be certain in uncertain times that these medical issues do not stop because of the pandemic. And patients need to know the symptoms, the signs, what to do, who to call, and how to react.
Definitely. And I know for some people, they may be fearful of going to a hospital right now because they're scared of contracting COVID-19. But what precautions are hospitals, ambulances taking to keep non-coronavirus patients from getting the virus?
Well, of course, the paramedics themselves are practicing universal precautions. Everyone's wearing a mask. When the patient's brought to an emergency room, the patients are typically masked. There is, in most emergency room facilities, a rapid COVID-19 test has become available. So very quickly now, in most large academic teaching hospitals and emergency rooms across the country, we are being able to diagnose COVID-19 a little bit quicker. And then if the patient is COVID negative, those patients can be triaged to a different part of the hospital. This wasn't true in the beginning of the pandemic because it took days in some cases to get the results back now. But we can do pretty rapid screening while these people are getting triaged for the appropriate care. For a heart attack, these patients are typically brought to the catheterization lab for angioplasty because the most common cause of a heart attack in that context would be a clot. and these patients are treated, they're treated with what's called primary angioplasty. And with regards to recovery from a heart attack or treating it, time is muscle. The sooner you get to the cath lab, the sooner you get a treatment, and the better the outcome and the better the prognosis. What's happening, as I said, is fewer people are showing up at emergency rooms, and we suspect that many people are dying that shouldn't be dying because the systems are already in place to deal with both heart attack and stroke. And patients need to remember that if they have these issues, that they should call 911.
Yeah, they shouldn't be fearful, of course, of going there because they are separating the coronavirus patients from non-coronavirus patients. But do you anticipate that some people who are seeking emergency services might get some hesitation or some pushback from 911 operators or maybe hospital staff when they do go in?
I think this has been a regional issue. Of course, New York City was overwhelmed in the last couple of weeks. They had an 800% increase of cardiac arrest deaths at home, in that, end of March, beginning of April. So the paramedic system in New York clearly was under stress, almost like a wartime type of situation. That's what they alluded to. In Los Angeles, in San Diego, in Northern California, we've had a better ability to handle the surge of COVID-19 patients, and traditional stroke and heart attack care is available 24 hours a day, 7 days a week. And the message to patients is if you have the symptoms, like I said earlier, of chest pain, of difficulty breathing, or symptoms that would suggest a stroke, that should lead to a call for 911. The Heart Association has a mnemonic. It's called FAST, F-A-S-T, and FAST is an abbreviation for facial drooping. That's the F. A is for arm weakness. S is for speech difficulty, and T is the time to call 911. So at the end of the day, I think this is all about education. The operators know how to triage people who present with symptoms of stroke and heart attack. Now, having said that, many people who have active COVID-19 infection will have cardiac involvement. And some of these patients who get taken to the cath lab with what appears to be an active heart attack, in fact, have myocarditis, which is inflammation of the heart, a different kind of medical problem. But
Yes.
COVID-19 can mimic heart attacks as well.
Wow. Well, I think what you said was important. Education is key, and that you need to continue calling for service if you need it. Do not be fearful during this pandemic. Thank you so much, Doctor, for joining us.
My pleasure. Have a good day.